If you're a subscriber of mine, I know you come to my channel for thrift with me's, DIYs, room makeovers, but unfortunately, this is not that type of video. I took a little break for a couple of weeks off of Instagram and YouTube, and I had a lot of you reach out to me asking me, am I okay? And I appreciate everyone who has reached out to me. The past few weeks have been hard, really hard. But the past 2 years have been very difficult. I thought long and hard before I decided to make this video. I have been kicked down a lot of times in my life, and I've always appreciated when someone shared their experience with me and they were open with me, because it made me feel like I wasn't the only one feeling this or going through this. And that is my hope and intention with this video, that maybe if you're out there and you are in the same situation as me, I don't know if this will give you some comfort. I don't know if this will give you some insight, but at the least, maybe it'll just let you know that you're not the only one who has gone through it or is going through it. My father passed away about 26 years ago, and my mother relied on my father for everything. He was the one who kept up with the money, paid the bills. My mother had no idea how to use the ATM, how to write a check, how to pay bills. She had no idea. She moved in with me about 8 months after my father passed away, and at the time I was about 23 years old, already had 3 small children, and she moved in with us, and I'm the one who had to take over paying her bills, going to the ATM, things like that. So in some ways, I took over the role as my father when it came to my mother. 16 years ago, my mother was diagnosed with colorectal cancer. She worked a full-time job. She was also receiving chemotherapy and radiation while she was working full-time. Not long after she started her treatments, she actually ended up with severe diarrhea, which led her to being in the ICU fighting for her life. She ended up having sepsis. She was only in the hospital for a few days when I had to make the decision, along with my sibling, on whether or not to put her on life support. We said yes, and my mother fought for her life. During her 6-month stay in the hospital, she would end up on life support 2 more times. She fought, and she fought. She had to learn how to walk again, and she even had to learn how to swallow again. Her doctor decided to not continue the radiation and chemotherapy, so they went the surgical route and they removed her large intestine, which left her wearing a colostomy bag. My mother seemed to be doing so well after this ordeal, but she did start showing signs of forgetfulness, which was very odd for my mother. Fast forward a few years, it would be a week before Christmas. My mother decided to walk the dogs. It was late in the evening, and she didn't turn the outside light on. She missed one of the steps, and she fell and broke her hip. After the surgery to repair her hip, she would stay in a rehab facility in a nursing home. She would only be there for a few weeks, but little did we know that breaking her hip, combined with being in this new environment, would light a fuse under what we thought was forgetfulness. Now we know that it was dementia. Five years ago, my mother would be officially diagnosed with dementia. The doctor put her on some medication, hoping that it would slow the progress of the disease, but after about 1.5 years, it didn't seem to be doing anything. She seemed to be actually getting worse. So the doctor took her off of it, and we decided not to put her on any more medication for the disease, because I didn't want to keep my mother pumped full of drugs, especially if it wasn't going to help. And at that point, the medicine she was on seemed to be making matters worse. So she was diagnosed 5 years ago, but 3 years ago is when everything really started going south for my mom. The last 3 years have been bad. The last 18 months have been awful. And the past 6 months have been teetering on hell. As we know, 2020 was not a good year for a lot of people. A lot of people struggled with depression, with job loss, and our family was also affected. Last year, we had 5 family members move in with us. They lost their jobs due to the pandemic. They had children, and they had nowhere else to go. So, of course, since it's family, we said, of course, come in and stay with us. We already had 7 people living in my home at the time, so this gave us a combined total of 12 people in my home for the majority of last year. I believe it was about 8 months. Now, don't get me wrong, I am not complaining whatsoever about helping family and with us having so many people in our home. Our home is large enough to accommodate the family members we had here last year, but having all the new faces here really took a toll on my mother, I could tell, because she was acting out. She was very suspicious of the smaller children that were here. She was saying they were stealing from her. She was making accusations about the other family members in here, and none of it was true, but I could see how just my mother's routine being disrupted and with new faces being around, it really just, it impacted her a lot. With dementia, a lot of times they do get very suspicious. They don't trust. And just all the new faces seem to really just make this worse for my mother. And around the time the other family members moved in, my mother started having some peculiar behaviors. One of the first things is that she would start cussing me. She was accusing me of sleeping with all the men that would come in and out of here, but she wouldn't use the word sleeping, which was very odd for my mother because she did not use language like that. She would call me a whore. She would call me a slut. And even though, you know, it's the disease, it's still your mother saying these things to you, and it hurts. And I had so many people tell me, it's a disease talking, it's not her, but it's still my mother saying it, and it hurt. She would also get aggressive with me. She would grab my hand and just sink her nails into my hand or my arm. She wasn't sleeping. She would get up in the middle of the night. She would go through the refrigerator, just eating whatever with her hands. She would go through the pantry and just eat whatever. She was even eating stuff that wasn't food. Due to this, we had to lock the refrigerator and we had to lock the pantry. She was also getting where she didn't remember how to make coffee. Now, my mother drank coffee from the time she came out of the womb and was making coffee ever since she was that young. And she didn't know how. Instead of coffee filters, she would put a piece of bread in there as a filter, or she wouldn't use a filter at all, or she'd put napkins. And she would just have to ask me, where does this go? And I would just look at her like, how do you not know? She would also be talking to people who weren't there. She was waking up in the middle of the night, banging on my door, saying someone was in her room, and I would have to go in there and assure her no one was in her room. She would repeat the same sentences over and over. I would feed my mother. 5 minutes later, she would say that she hadn't eaten all day. She would get very aggressive about it. So I was constantly giving her snacks, but I kid you not, in one day, she could tell me 100 times that she was hungry. And I'm not over exaggerating that. She had gotten to where she was saying the same sentence hundreds of times a day, saying the same thing, just constantly talking all the time. She would also collect stuff from around the house. She would hide it in her bedroom. I would have to go in there at least once a week and just sweep the room, just see what was in there. People were missing stuff. As I said, we had other family members in here. Their stuff would be in my mom's room. She would collect this stuff. And it was all very innocent, obviously. My mother wouldn't steal from anyone. But there were just really peculiar behaviors that we started noticing as soon as new faces came into the house. Another thing that was happening is that she would be disrupting my husband as he was on phone calls. My husband works from home. He has his own office. She would bang on the door. And if my husband would forget to lock the door, she would walk in while he was on a conference call. She would get very loud. She would ask all the time where I was at. So once she started disrupting him all the time, he would call me at work. I would have to leave work early and come home. It finally got to the point where I had to ask my employer, could I work from home? And they went back and forth. One said yes, one said no, because I just could not leave her here, especially with other family members here, which were a lot of children. And since there was no school last year, the kids were also doing online classes, and my mother would walk in while they were doing online classes. The kids were very sweet to her though, but she had no clue what was going on. So during this time, I sat down with my husband and I said, I've got to make a decision. My employer will not let me work from home, even though everything I did for work, I could work from home. And the day I had to make a decision to quit my job, I also had a doctor's appointment. And I went to the doctor, and I was having so much anxiety. I was having a breakdown in the doctor's office because at that point, I would cry every day. Last year, rarely was there a day you didn't find me crying in the closet of something going on. Just the added stress of having extra family members here and also having to deal with my mother around these family members. It was hard. It was hard. I had a lot of breakdowns. So I'm in the doctor's office and my blood pressure's up. I have an ear infection. I am shaking. And the doctor told me, she said, if you don't do something, you're going to end up in the hospital. So I went home, sat down with my husband, and I had no plan. I just knew I had to quit my job, which meant we would be one income less in the house. So I packed up my laptop, drove to my employer, handed my manager my laptop, cleaned out my desk, and left. And this was October of last year. And that was one of the hardest, and weird to say, but one of the easiest things I ever had to do. So a few weeks later, the family members that we let stay with us found them a place, they moved out, and things started to calm down for a couple of months. I had my mother on a schedule, and she was going out to the thrift stores with me. She was helping me do things. Now, her mind was still deteriorating, but I had her on a pretty good schedule where it just made it easier for her. To make some money on the side, I started selling on eBay, and I would take my mom with me to the thrift stores. One day we were in the Salvation Army, and she was right in front of me, and she started looking for me. She started calling my name very loudly, looking for me. Now, mind you, she stopped recognizing me months prior. But when we were in the store, she was looking for me. Now, when she was looking for me and she was asking for me because she had done this at home, she was looking for the child version of me because she had no idea who I was. So once we were in the store, she started walking down the aisle, and I had to go after her because she was ready to leave. She was getting panicky. She had no idea where I was at, and we had to go ahead and leave. And right then and there, I realized I could not take her out again with me. Her dementia started to steamroll after this, and right when I thought it couldn't get any worse, it did. There are other factors that made my mother's dementia very hard to deal with. The first is that my mother cannot hear. My mother has worn hearing aids ever since she was, I believe, in her late 50s. She needed them even before then, but never got them. And last year, I have reason to believe she flushed one of them, and I know the other one she tore up somehow. She was picking at it. With dementia, a lot of times they will pick at things. They will concentrate on one thing and just zone in on that. And that's what she did with the second hearing aid. I got her a cheaper version of hearing aids, but she would not keep them in her ears. By this time, she had no idea what they were for, so she just went without hearing aids. And with her being unable to communicate and having dementia, it made things 100 times worse. I would have to write things on the whiteboard, but eventually it got to where she had no understanding of what I was writing, so I would have to get in her left ear and talk very loudly, and then she would get upset because she was thinking I was yelling at her. So it was very hard to communicate with her, which made the dementia so much worse. As I mentioned, my mother had colorectal cancer, which led to her wearing a colostomy bag. She forgot how to change it, so I would take over doing that for her, but inevitably, she would end up taking the bag off, and you can use your imagination. So I was constantly cleaning up feces off of the walls, the toilet seat, the sink, and her carpet. And she would get her clothes out of the closet and use her clothes as rags to clean up the mess. So then she would have clothes that were destroyed because I couldn't put them in my washing machine. It was so hard seeing her almost like a child. When I would go in there and catch her with the colostomy bag off, and she was using a shirt or a pair of pants to clean herself with, and then she would lie just like a little child would, that someone came in and took it off, or that it fell off. And so changing those roles from being a child to being the mother of your mother, it was very hard to watch. My mom was also addicted to nicotine. She had dipped snuff from a very early age. My mother is in her 80s. She lived out in the country. That's just what they did. Her grandmother gave it to her. So that was another obstacle, because when she did not have the nicotine in her system, her going through withdrawals combined with the dementia just made everything a million times worse. So I really had to make sure, because she would even forget, and I could tell there was a change in her when she didn't have any nicotine in her system. So that was just another thing to add on top of the dementia. So you have the dementia, you have her wearing a colostomy bag, you have her being unable to hear, along with an addiction to nicotine. Where some people only have to deal with, a parent with just dementia. Just think about adding all these layers onto that. And that's what made it even harder, not just on me, but on her. Just having all these other little nuances on top of the dementia. I cannot explain how all these things made it so hard to deal with. In February of this year, Mr. C and I decided to go out to run some errands, so we asked our older son if he would look after my mom while we were gone. By this time in February, we had special locks on the doors. We had a lock on the refrigerator. We even had baby gates put up so she could not go into certain rooms because I was terrified that she would get into something, that she would take medication that wasn't hers, that she would try to eat stuff that was not food. I even had to barricade the area where my buffet is and my coffee bar is going into the kitchen. I had to actually put a couch there along with another piece of furniture so she could not get into the kitchen. And I did this because I did not want her getting a hold of a knife. I didn't want her, like I said, getting into medication or food she shouldn't eat. So everything was very child-proof because that's exactly the way I felt, like you were making your home to where you had children in it. So, you know, we felt fine about leaving. We left. We weren't even gone very long. It might have been like an hour and a half. Come back home and I asked my son, you know, how is she doing? He said, oh, she's fine. She's in her room sweeping. So we go in her bedroom and she's nowhere to be found. We look everywhere. The doors are still locked and I'm thinking, where is she at? We go downstairs into the in-law suite where my mother-in-law and father-in-law live. She's not there. We have no idea where she's at. And I'm panicking by this time. We get in the car, we drive around the neighborhood, and finally I tell my husband, we're going to have to call the police. We call the police, and they picked my mother up, walking in the middle of the highway. Yes, she actually, this 82, 83-year-old woman, climbed over the buffet, 83 years old, and she weighs hardly nothing, went over that and went out the back door, the one we went out of, because we didn't lock that because we never thought she would climb over the counters because they're pretty high, and she did. My son felt so awful about this. He was actually in the restroom. He said before he went to the bathroom, she was in her room cleaning. He'd come back out. He didn't think to look in there. He was just assuming she was in there. He felt really bad about it, but I'm telling you, if you know anyone who has dementia and they're a wanderer, they can get away from you like that. Just like she almost did when we were in the thrift store. It's amazing how quick my mother was. For the past 6 months, my mother would go from one extreme to the other. She would either sleep for 20 hours, or I would have to wake her up to eat, drink, use the bathroom, and take her medications, or she'd be up for 20 hours. And for the 20 hours that she would be up, she would pace the floor. She would go from door to door saying she had to leave because she was a wanderer. She would just shake the doors, bang on the doors, saying, I gotta go, I gotta go, I gotta go. She would repeat the same phrases over and over. It was hard to get her to sit still, even to eat. She would burn more calories than she was taking in because for 20 hours, no nap, no rest, constant pacing. If you can only imagine someone in your home walking from door to door wanting to get out, constantly talking, getting loud, getting aggressive, for 20 hours. I mean, just think of somebody talking incessantly in your ear for, I don't know, 30 minutes. That's a long time. Think of 20 hours. And it was so hard to deal with that. At first, I would try to get her to sit down or to go take a nap. It didn't work. So finally I had to let her, almost like you would a baby, self-soothe themselves. I knew eventually she would wear herself out. And there were days she looked like a zombie walking around. It was like her brain could not turn off. And if she was up 20 hours, guess what? I was up 20 hours, which meant no sleep. And during this time, she started urinating in her closet and in the corners of her room. She had her own bathroom, but for some reason, when she'd get up in the middle of the night, she would go into her closet. I even bought her like a bedside toilet that people use, you know, if you can't make it to the bathroom. She might have used it once, but the majority of the time she was using her closet as a bathroom. There would also be days where I would get up in the mornings and she was in her room walking around with no clothes on, or she would do the opposite where she would have 10 sweaters on and 3 pairs of pants. It just did not make any sense. I would also have days where she would not take her medication. She accused me of trying to kill her. She also had nights where she would wake up yelling. She would be knocking on doors saying she had to leave, so she would wake everybody up. And every time I would try to change her clothes, every time I would try to clean her, brush her hair, put lotion on her, anything like that, she would say I was trying to kill her, that I was killing her. She would even tell Mr. C that I had beat her, that I had cut her legs off. I mean, it was just, it was so extreme. And I'm looking at her like, I am your daughter. I am trying to take care of you. I'm the only one who is taking care of you. So to have someone that you're giving everything to, and they're accusing you of all these things, and they're calling you all these names, even though I know it was the dementia, it still hurts. It hurts when you're pouring out so much into someone and you feel like they're just so ungrateful. And I know it's a dementia. I know this. It still doesn't make it any easier. It still doesn't make it any easier when it's coming out of your mother's mouth. There were days I would lay in bed at night and just cry, and I would ask God, why don't you take her home? Why don't you just end her suffering? And in the same breath, I would say, but you know, I know that I'm not God, and it's not my decision when someone leaves this earth, it's God's decision. And then I'd be so ashamed that I even thought those things. I would just see her suffering. And the thing is, she doesn't even realize it. She didn't realize with all the episodes she was having and everything she's doing that she is just not her. She has no idea. I see it. And that's why I would just pray to God to just take her. Just take her home. Let her body and her mind be at rest. Because just seeing her in that frantic, erratic behavior, it was so hard to watch. For the past few years, I wouldn't say I've harbored anger or hate. Maybe it has been anger, but I have really needed the support and help from my sibling, and they just checked out. They didn't ask how I was doing, didn't text, didn't call, didn't visit. So I guess you could say it has been anger that I have been harboring, which I have since forgiven my sibling of not being involved. I haven't said it directly to my sibling, but I have forgiven them in my heart because I don't want to carry that with me the rest of my life. I will say that my sibling lost their spouse 8 years ago. Their spouse was killed a few days before Thanksgiving. And I have never once ever said to them, oh, just get over it. You know, time heals all wounds and all this other crap people say. I've never thought that. Because I cannot imagine losing a spouse the way they did. So I've never tried to diminish their pain or saying to them, you know, that their feelings weren't valid and their pain isn't valid. I've never done that. Never. Whenever my father was only given 6 months to live, my mother had to quit her job. So she had to move in with my sibling and their spouse. And their spouse helped my mother out tremendously with my father. Their spouse was one of those caring and giving and selfless people I have ever known. I believe that my sibling uses the death of their spouse as a reason to not participate in life. And at this time when I really, really needed my sibling and I needed their support and their help, they weren't there. Not having my sibling not having their support during all this has made this journey even harder. About 4 weeks ago, my mother fell. She got up, she seemed fine. She was not one to really be unstable on her feet, so falling for her was not usual. Well, the next day, less than 24 hours later, she fell again, and this time she was not able to get back up, and I could tell whenever she stood up and tried to walk that there was something wrong with her hip. So we called the ambulance and had her taken to the hospital. Sure enough, she had a closed hip fracture, and due to her age and just due to really her state of mind and everything else going on with her, they didn't feel like surgery was the best option. While I was in the ER, a physician came in and I broke down in front of her. But she was the sweetest person I have met so far in the medical profession. And I was telling her that I was exhausted. And just looking at my mother laying there, you know, in the emergency room, I told the physician, I said, I cannot take her back home with me. And she looked at me and she said, of course not. And just seeing how compassionate she was with me, and she even came over to me, she said, I know I'm not supposed to do this, but she hugged me. And I just broke down. I was just it was like I had so much inside of me that I was finally able to release, because someone finally understood what I was going through. And she said, of course not. She said, I would suggest long-term care. And so I left my mother there, because when it comes to putting someone in a rehab center and long-term nursing care, there are rules you have to follow, like they have to be in the hospital so many days, and they have to be in the rehab center, It's a lot of hoops to jump through. So I left my mother there because they were going to keep her in the hospital for 3 days. And I walked outside and I called Mr. C. And I just broke down crying. I was crying because I was happy. I was crying because finally someone understood what I was going through, because her regular physician kind of brushed it off. Her and I share the same physician, and even Mr. C talked to the physician, and it wasn't good when it came to my mother, because we really just were looking for help. We were looking for help for my mother. So as I'm on the phone with Mr. C, all these emotions are just coming out. And even though I'm feeling happy, then the feeling of guilt comes over me because I'm feeling happy. You know, it just doesn't make sense. I'm happy for my mother that she's going to get the care she needs. But of course, guilt comes up, like, you're happy? You're happy that your mother broke her hip? You're happy that she's going to a nursing home? So all of these emotions are just flooding me at the moment. And, you know, some good, some bad. So it was the next day, and this is where God showed up and showed out. The caseworker at the hospital called me, and she said, okay, she said, you're looking for long-term care, but first we have to get her in a rehab center. Now, a rehab center is inside of a nursing home. And she said, you're going to find a rehab center that can just go ahead and take her, but can't take her long-term, and then we'll just find somewhere else? Or would you rather me find a place that can take her for rehab and for nursing care? And I said, yes, I want to find just a one-stop shop where, you know, we don't have to take her in and out of different places. And she said, fine, we'll do that. She sent out feelers, or whatever they send out, you know, just to see what nursing home had the availability. And she called me back. It might have been the same day. And she said, okay, she said, I found a place that's probably, I think it's like 8 miles from our home. And she said they can take her for rehab, and they can also take her for the nursing care or the memory center care. She needs memory care. And I'm like, great. And she said, okay, go ahead and start filling out the Medicaid application. And she said, and then call the lady in admissions at the nursing home. So I'm in the middle already. I'm in the process of doing all the Medicaid forms. And I called the lady in admissions. She said, when can you meet me? I said, I can come right now. So I go over there, had to drop what I was doing with Medicaid, go over there to the nursing home to talk to the lady in admissions. And I'm filling out paperwork. And if you've ever had to fill out paperwork for someone going into a nursing home, I've had to do it before with a rehab center because my mother broke her hip years ago, as I mentioned. This was a lot more. This looked like 500 pages we had to go through. So as we're going through all the paperwork, she tells me, she said, we actually don't have an available bed for your mother for memory care. And I'm like, what? That's not what, you know, the caseworker told me at the hospital. Didn't say this, I'm thinking this. She said, but she said, I am friends with the lady at the hospital. We've known each other, I think she said 15, 18 years. They worked together. And she said, I'm doing her a favor because she recognized how burnt out you are and how much your mother needs this care. She said, we are understaffed. She said, but I am taking your mother in as a favor to my friend at the hospital. Now, I don't believe in coincidences. I just don't. I don't believe in coincidences. I believe things are set up in a certain way. And just knowing that my mother broke her hip at this day to get this caseworker at the hospital who knew this person who works at this excellent nursing care facility, 5-star. I mean, it looks like a little mini what do you call it, a country club. It is fantastic. And so I start bawling. And I'm just crying, And she looks at me, she said, honey, she said, this is God. She said, because I'm turning people away every day that want to get their parents and loved ones into this facility because it is such a great facility. So I felt so good about that, so good that my mother would be in this wonderful nursing care facility. So over the past few weeks, I have been going through her room, getting rid of a lot of stuff, and we had to rip up all the carpet. I now have to paint her room. I've got to redo stuff in there. I have been going through paperwork. I've been doing stuff for Medicaid, for insurance, running back and forth to the hospital, the nursing home. Just the month of June, I don't know where it went. I really don't know where it went. And of course, even getting her into the nursing care facility, I started feeling guilt again and shame because I could not take care of her. And I remember talking to the lady in admissions. I was visiting one day and I was walking past her office and she stopped me and we started talking. And I told her, I said, I still have these feelings of guilt that I'm happy and that I wasn't able to take care of my mother. And she said, honey, she said, God organized all this. She said, if God's involved, you should not feel any guilt. And I never even thought about it that way. Remember, all the thoughts in your head don't come from you. Just remember that. All the thoughts in your head don't come from you. So I had all these feelings, of guilt, of shame, of hurt, of joy, of happiness, just relief that I could breathe. All these emotions. So I'm trying to process all these things in the midst of getting her room clean, getting rid of stuff, getting her settled over there, getting paperwork done. All these people calling me from social services, from insurance, from pharmacy, from the nursing home, just so much going on that I really didn't have a moment to stop and process all the feelings and emotions that were running through me. My mother was there just a few days whenever I had to speak with the head physician at the nursing home, along with the rehabilitation therapist and the head nurse. And we're sitting there talking, and she's telling me, she said, your mother is in the last stages of dementia, which I knew this. I have said this for a long time, that I to my husband and to my sons, that I can see that she is in the last stages. And she told me, she said, it only looks like she may have 2-4 months, maybe 6 months to live. Which I knew this, but then when you hear it, even though you know it, when you hear it, it hurts. And during this time, so as I'm sitting there, and they're telling me, how much longer she has to live. And we're going over things like, do I want her resuscitated? Do I want IV fluid? Do I want all this stuff, when that time comes? So we're going through all this, and I'm sitting there, by myself. Don't have my sibling with me to make these decisions about our mother. And then I'm thinking to myself, do I call my sibling and let them know? Because they haven't been in the picture. And of course, I have to do the right thing. I can't be selfish. I can't be, since you weren't in the picture all these years and you weren't helping out, that you don't need to know. And that's not good. And I can't live with that. I can't call myself a Christian and then harbor all this hate and then just be so selfish as to not let someone say their goodbyes. I couldn't live with that. I had Mr. C call my sibling because I couldn't do it, or I think I would have said something I would have regretted. When it comes to me, when it comes to family, and someone has hurt a member of my family, I go off. I've done it in the past to family members when they have disrespected family member, when they have hurt family members. I go off because I cannot stand when someone is ungrateful. I cannot stand when someone shits on their family. I cannot stand when for me and Mr. C, family means a lot. So I knew I could not talk to my sibling, or I would say something I would deeply regret. So I let him handle it. And my sibling admitted that they had not been in the picture, and that once their spouse passed, they were not the same person anymore. And that they just kind of gave up. And I believe they use their spouse's passing as a reason to not participate in life, to not even come around myself and our mother. I really believe my sibling missed a beautiful gift over the past 5 years. Because over the past 5 years, my mother's really just gone downhill. I believe my sibling missed a beautiful opportunity to be part of this and to be supportive to me and our mother. And while doing this, it possibly could have been the key to have healed their hurting. Whenever we're hurting, we don't want to help people. We don't want to do anything. But a lot of times, your healing comes in the form of helping others. And I believe they missed a beautiful, beautiful gift that could have healed their heart. I've never once said they should ever forget their spouse. Of course not. This person was a beautiful person. But just dropping out of life, especially when you have a sibling and a mother who needs you, in some ways I believe it's very selfish to just say, I'm done. But at this point, my sibling lost a beautiful opportunity. Just a beautiful opportunity to help me, to be supportive for me. Because really, it was more, if they would have come around, more support to me than our mother. You understand what I'm saying? Their involvement would have meant so much to me, and it could have brought us even closer. Because we didn't grow up together. My sibling is a little bit older than I am, and we didn't grow up together. So this could have been a beautiful opportunity for us to get even closer. And it's done nothing but just made us even farther apart. And also, Mr. C told my sibling that the woman that my sibling is going to go and see at that nursing home is nothing like the woman that lived here that I had to deal with. Now that she is in a nursing home, she is on medication to help her not be so high-strung and so erratic. And also she can't walk, so she's in a wheelchair. Here, she paced the floors constantly. And even now, when I go visit her at the nursing home, she is very calm. That's not what she was here. I dealt with a frantic, manic, loud person that at times would just spew hate. And even though I know it wasn't hate, it was still coming from my mother, so it still hurt. So when my sibling goes and sees our mother, that's not what my sibling is going to see. My sibling is not going to fully grasp what I dealt with. When my sibling goes over there, they're going to see our mother in a wheelchair, clean, everything smelling good, her calm. And that's not the way it was here. Here, she was taking her colostomy bag off. I was constantly trying to clean her room. The carpets were filthy, where there was feces and urine that I constantly tried to clean and could not get out. She was erratic. She was not calm. So my sibling isn't really going to grasp the full picture of what I had to deal with. It is so nice to go visit my mother at the nursing home and just sit with her and hold her hand. And she's very weak now. But she'll sit there and her sentences don't make sense. They didn't make sense here. They don't make sense there. And she doesn't know me. But just to sit there with this woman who was such a wonderful woman, and just to see her calm, and just to know that she is going to die with dignity in a beautiful facility around people who are just fantastic, that means more to me than anything in this world. I think the part that really sucks about all this, if you followed me long enough, you know I have 3 sons. My 2 oldest ones have seen their grandmother decline over the past couple of years. And my youngest son lives in Japan. He's been there 2 years now. In 2 years, I have not been able to hold him, hug him. I miss him so much. So when I had to call him and tell him his grandmother may not live till the end of the year, that was hard. He is hoping that he'll get home for Christmas this year because he'll be vaccinated soon, but he's not sure if he'll be able to get here in time to see his grandmother, to even say his goodbyes to her. So that really, really sucks. During this journey I've been on with my mother and her dementia, I know I have not acted like I should. On the days that she would call me a whore or a slut, or say I was killing her, or she was yelling, or she would just grip her fingers into my hand, I would be so angry and so hurt. I have yelled at her. I kept saying, "Why are you doing this? How do you not know who I am? I'm your daughter." And I would yell it at her, "I'm your daughter." And she would look at me like I was just a stranger. I would have to walk away from her. I would have to go in my room and just cry. I would have to walk outside. I would be so hurt and angry. And I had so many emotions running through me. But that's just not my mother. My mother wasn't like that. My mother was always a very giving person. Her and I had arguments. What mother and daughter don't? But we could have arguments, and then the next minute I'd be like, "Hey, you want to get a cup of coffee and go to the thrift store? Yeah, let's go." That's mother and daughter, you know. And that was when she was in her right mind. But overall, my mother was very giving, very loving. She loved to take care of people. And so just to see her so ungrateful and to just have that anger toward me, and I'm the one taking care of her. I was the only one taking care of her. It just hurt. During this, I know I didn't deal with everything the right way. You can read all the books about dementia. You can hear other people talk about their parents who had dementia. But until you've actually lived with it 24/7, every day was just so different. I didn't know who I was waking up to find. And with her being so angry at times and calling me names, it would just cut like a knife. She would have days where she was just so angry. And after calling me the names, and then she would just switch and she would want to hug me, and I didn't want to hug her. It's almost like when someone, if you're in a bad marriage and I guess someone would beat you and then they want to hug you afterwards and say, you know, they're sorry. She wasn't saying she was sorry. She just wanted to hug me. And I just couldn't hug her. So I'm like, you just called me every name in the book. You're so ungrateful. And now you want to hug me. It was so hard to process. And then I would have people tell me, oh, it's just the dementia. It's not her. You know, don't worry about it. It's my mother. It's my mother telling me these things. It's my mother putting me down. It's my mother yelling at me. It's my mother just being manic and then wanting to hug me. It's so hard to understand unless you're dealing with it. It was very hard to separate my mother from the illness because it is my mother and she has this illness. So it's very hard to separate the two. And people always want to tell me, you know, well, it's the dementia talking and it's not your mother. Yeah, well, it's my mother talking who has dementia. And it's really, really hard to separate the illness from the person. But even though having to deal with this day in and day out, I may not have dealt with everything the right way, but I always took care of my mother. I did it the best I could without having a medical background and just going by what I felt was right, but trying to keep her safe without her wandering, without her getting out like she did before, with making sure she would eat and try to keep her clean. You know, I may not have done everything the right way, but still I was here day in and day out. And I think a lot of times just showing up, just being there. And I was the only one being there. And I did it to the best I could. But it still hurts because I still feel guilty because I didn't do things the right way all the time. But I was still there. I was still there taking care of her. And doing it the best I could out of love. Because there were days I just wanted to leave. There were days I just wanted to pack all my shit and leave. Because it got so hard. And that's why I'm so grateful that now, the last few months of her life, I can enjoy my mother. I can go to the nursing home and I can sit there. Even if she doesn't know me, I don't care. I know her. And I know what a wonderful mother she was. If you were taking care of someone with dementia, Alzheimer's, or any kind of illness, I understand what you're going through. I understand what you're going through. And if you don't have support around you, it's really hard. And if I
did not have the husband I have, I would have went off the deep end a long time ago. There were days I just had to get out. And so Mr. C would look after my mom, and I could go to the thrift store, I could run some errands. I couldn't stay out long. But just getting away for a little bit of time helped so much. And, you know, this is not his mother. And even though he loved her just like a mother, because she had been living with us for 26 years, I appreciated it so much when he would just look after her. Or if one of my sons had, you know, a little bit of time, which I never looked at my sons as the ones who had to take care of their grandmother. That's not their responsibility. It's not my children's responsibility to take care of their grandmother. It was my responsibility. So I did appreciate the times when my sons would help me out. But I never wanted to put that burden on them. I wanted them to enjoy their grandmother, not feel like she was a burden on them. And she would never want to feel that way. And when you're taking care of someone with dementia, you have people around you and they all say the same thing. Well, if you need help, or, you know, you should really take time for yourself, and you should, you know, seek out help. People's words mean, they mean well. They mean well. But when it comes to bringing someone from the outside in, a lot of times, anytime someone new was in our home, it would completely frazzle my mother, and she'd get very suspicious. What are they doing here? Or she would think there was someone else. And having to pay, how am I going to pay someone when I don't have a job? I had to quit my job. And insurance is not just going to let you bring someone in. There are so many hoops you have to jump through. If it weren't for my mother breaking her hip to have to go to a rehab center, I would never have been able to get this long-term care for her. So her breaking her hip was a blessing in disguise. And I'm just so grateful that she is getting the care she needs and deserves. She deserves this, and I am so happy she's getting it. If you're also a caregiver, I don't want to just put this video out there just to say, oh, woe is me. You know, look at me, look what I have been through. That's not it. I don't want anyone taking pity on me. I've always been a strong person, been able to deal with things. But I didn't want to just put this video out there for that reason. You know, just to say, oh, and I don't want pats on the back. I don't want anything like that. I just did what I was supposed to do. The main reason for me putting this out there is that I understand if you're going through this. And if you are, I'm going to leave some resources in the description box. Some of these helped me. They were online resources, just listening to other people's stories about what they were going through. And there's some other things down there I'm going to leave. I didn't want to just put this video out and say, oh, I just want everyone to feel sorry for me and thank you. No, that wasn't the reason for this video. This video, for me, for one, was very cathartic to get this out of me. And for two, I really believe that this is a community. And so many of you, you're always watching my videos. You're always commenting on my videos. You're DMing me over on Instagram. And I feel like we are friends. And I just want to share. And I think that's how you build a community, is by sharing. Now, this is not the normal videos I put out. This will be the only video I ever put out like this in this on my channel. The rest of it is going to be what I usually put out. But I really want to put this out just to let someone know, if you're going through this, you're not alone. You're not alone. And I'm going to leave the resources that I have used in the description box that maybe can help you. I also want to say thank you to everyone who has reached out to me when I was going through all of this, and I didn't really come out and say what it was, but I want to thank you so much. It really means a lot to know that, you know, if you miss a couple of weeks on YouTube, people kind of wonder where you're at, because I really want this to feel like a community. I enjoy making videos for all of you to watch. I hope this video didn't bring you down. And like I said, it's not meant to say, oh, look at me, look at what I did. No, I did what I was supposed to do, and I took care of my mother. I really just wanted to put it out there in case anyone else is hurting, in case you think you're alone. You're not alone. And I really believe that there is a season for everything. And just know, if you're going through something, it's going to pass. Nothing lasts forever. Nothing. I have been through so much in my life when it comes to illnesses in our family, when it comes to money problems, when it comes to drug abuse, when it comes to alcoholism. So many things in my family that I've had to deal with. And just please know that there is a season for everything. And you may think that things are going to never get better. But I promise you, for everything there is a season. Nothing lasts forever. And you will come out on the other side. And if you are going through something like I went through and you need someone to talk to, reach out to me on Instagram. If there's something I can help you with, if you have a parent or loved one with dementia and you're going through the same thing and you feel like there's no one to talk to, just reach out to me. Thank you so much for watching, and I will see you at the next one.